So hi everyone, my name is Rhonda Gallant, and on behalf of HR.com, I would like to welcome you all to our Experts Solutions in Employee Benefits and Wellness virtual event. So the title of this webcast is Navigating the Future of ACA and Healthcare Policy, and it is sponsored by Benefit Focus. This webcast has been pre-approved for one HRCI and may be submitted for a SHRM credit, so please be sure to attend the complete webcast in order to receive credits. If you have questions or comments during the webcast, please submit them using the Q&A in your webinar controls. All right, so it is now my absolute pleasure to turn it over to the presenters, Tom Dugan and Christopher Condalucci.
Great, thanks, Rhonda, and thank you, HR.com. Appreciate the time today. Looking forward to getting into this topic. Obviously, super relevant and very interesting, and somewhat dynamic over the last week as we've been preparing to get ready for this discussion. And so, first, we'll just start with some introductions. So, my name is Tom Dugan. I'm a leader in our strategy group at Benefit Focus, and have been in the employer-sponsored benefits space for about 15 years, doing a variety of different things, and working through understanding of the market needs, challenges, and certainly regulatory dynamics are always something that impacts what's needed, how a benefit strategy needs to be executed, and the tools and technologies that are part of that. So, looking forward to the discussion today. I hand things over to Chris to introduce himself.
Hi, name is Chris Condalucci. I am the principal of CC Law and Policy. It is a legal and policy firm where I run my own practice. I focus on legal matters relating to the Affordable Care Act and the employer-sponsored market. And I also work on policy issues relating to the Affordable Care Act and employer-sponsored market. And I've been working with Benefit Focus for, a number of years now, and have been having a lot of fun with Benefit Focus and love the stuff that they do, in addition to other work that I do in the, again, Affordable Care Act space, individual market, exchange, et cetera, as well as in the employer-sponsored market with the fully insured and self-insured side of things. So with that, Tom, I'll turn it back to you.
Great, thanks, Chris. Yeah, and so as we think about our time together, just wanted to lay out a set of kind of key outcomes as we were thinking about the discussion, and there's really four. The first is starting with now that we have a little bit of certainty with President-elect Biden, what are the healthcare policy goals that he's laid out as part of the campaign and the election, and what's some of the potential impacts to employer-sponsored benefits, and then two, understanding the results of the Senate. Obviously, control of the Senate is going to have an impact on what can and cannot get done and when that might occur. And so, looking at the potential options that we could see there and the scenarios we could see there, and showing you guys a view into what that might look like. And then three, there are some things that have been moving forward that the election may not really directly impact, maybe some nuances. And so wanted to make sure there's awareness of a couple of regulatory dynamics, notably the transparency regulations, and what their impact and the timing could be, how a Biden election could potentially adjust nuances of those. And then lastly, just we'd be remiss to not take a moment to talk about the potential for ACA impact of the Supreme Court, certainly with today's starting of oral arguments there. And so we'll spend a little bit of time on that as well. So those are the four key things we want to work through in our time together. As we think about, where to start, probably the best place to start is just kind of looking at the election. There was a lot of projections around what might happen. And then, some things happened as expected and some didn't. So maybe a good place to start is, Chris, share a little bit with us what you felt was kind of the biggest surprise coming out of the election activity last week.
Yeah, and it's a great question, and just even the topics that we're going to discuss today that you outlined, Tom, really flow from everything that I'm just about to kind of opine on and fill everybody in on, because it really is important for us to wrap our head around the recent election results, but to not only wrap our head around the recent election results, but to also look to 2022. Because 2022 is going to be a big deal based on the election results that we just have generally found, even though there's not a lot of uncertainty, but there's still some uncertainty because we're at November 10th. There's still some back and forth on the presidential side. We have some questions relating to who will control the majority in the Senate, which, again, we're going to discuss. So at least right now, as of November 10th, based on what we know, again, we need to wrap our head around that and talk about 2022. So wrapping our head around, this most recent election, as Tom mentioned, there were some things that we kind of knew, but there were a lot of surprises. And what I really think that comes out of this most recent election is that the polls, once again, didn't get it right. On the presidential level, the polls suggested a much wider margin of victory for President Biden. That was not quite the case. A lot of the races, as many may know, are really, really close, which is leading to why we don't yet have all the certainty at the presidential level because of recounts, some lawsuits based on the closeness of the votes. And in some states, that wasn't quite expected, yet it was that close, which was a surprise. So it does tell us that even though the pollsters suggested that they made all the necessary tweaks relative to back in 2016 when the polls once again got it wrong, that they still didn't get it quite right at the presidential level. Most importantly, however, when it comes to talking about polls and pollsters and whether they got it right or not, the Senate was expected to flip to Democratic control. Right now, it does not appear that that is going to materialize. And many of those state Senate races where the polls indicated that the Republican incumbent was going to lose based on those polls actually outperformed what those polls even suggested, and they held on. And what I mean by outperformed, not only did the Republican incumbent hold on, but they won by like 6 points, which was a very surprising result. So again, an example of where the polls got it wrong and an example of where we didn't see a blue wave when it came to the Senate. Now let's shift to the House of Representatives, where the polls and the Democratic majority felt that they being the Democrats, would expand their majority in the House of Representatives. The opposite happened. Actually, Republicans picked up seats in the House of Representatives, which was, almost shocking. Like, no one would have expected that, and no one did expect that. Yet about 7 to 12 seats will have gone Republican when all the votes are finally counted and things are certified, which then results in, yes, the House is still controlled by the Democrats, but a much smaller majority. And in addition, many of those Democratic seats that were lost to Republicans were more moderate-leaning Democrats. So we now have a Democratic caucus in the House that is smaller and more left-leaning than what we had saw over the prior 2 years, which will have implications going forward and some implications on 2022, which I've mentioned. So the last thing I'll say, again, trying to wrap your head around 2022, and then I'll conclude on this segment, is the state legislatures. So the states, we can't forget about the states. The states are very, very important. When it comes to employee benefits and when it comes to insurance, to a certain degree, there's federal rules and federal jurisdiction, but there's also state rules that we have to worry about. If you're in the employee benefits world, especially in the self-insured world, you really only care about the federal rules because those are the rules that are most applicable to you. But if you're a fully insured plan or if you're in the individual market, the state rules, the state insurance requirements come into play. And so therefore, we still have a federal and state level that's important here to realize. But I'm also going to tell you another thing that is very important about states that actually is a big implication from this particular election. The state legislatures, just a week ago, many of them were expected to flip from Republican control to Democratic control. Well, that didn't happen. So I want to say literally every state that was in Republican control maintained Republican control. And we even had a few states, I think there's only 2 of them, New Hampshire and Alaska, where the legislature flipped from Democrat to Republican. On the governor's side, most governors remained either Democrat if they were the incumbent or Republican if they were the incumbent. But in states like Montana and New Hampshire, the governor flipped from Democrat to Republican. Now, I keep mentioning this, but why is that important? Why do I keep talking about Republicans, Democrats, state legislatures, governorships? In 2020, we all know there's a census that is going on, and we all have answered our census forms, et cetera. Well, once the census numbers come in, the states are required to redistrict their state and each of the seats within for the House of Representatives. And it is the state legislatures that primarily redraw those district maps. And if Republicans are maintaining control of the majority of the state legislatures, they will now have the ability to redistrict. And that redistricting, oftentimes it's supposed to be written on nonpartisan lines, but we know politics always comes into play when it's courts, when it's states, when it's federal, whatever. We will likely see some redrawing of the map in certain states that could have implications on the House of Representatives and how many seats Democrats have, how many seats Republicans have come 2022 and come the remainder of the decade, which is all very important. So to close on this part of our segment here, our presentation is, we kind of expected President Biden or Vice President Biden to become President Biden. So that wasn't too much of a surprise. It was a surprise that it was a lot closer than a lot of people thought, as well as what the polls said. We expected the Senate to flip. It doesn't appear that that's going to happen. We also expected the House to expand the majority. The opposite happened. And we expected the state legislatures, some of them, to flip Democrat. That didn't happen. So the blue wave that a lot of folks suggested, again, didn't happen. And so that's really, in my opinion, the big surprises from this election. And then everything I just told you is going to have implications on healthcare policy, both for the individual market as well as the employer market, of what we're going to talk about next. So, Tom, I'll turn it back to you.
Yeah, that's great. That's a great overview of some of the dynamics that come into play, and then certainly the ability to get things done for the administration, and then what is on the table or what's off the table, which we'll talk a little bit about, based on control or not controlling the Senate, and then even the timing of when some of these could occur and what 2022 could look like, as some of the more aggressive dynamics of the policy may not really be available until after a 2022 timeframe. So the next best place to go is probably to take a look at what we know. Biden is president-elect. So there was a great deal of information that was shared by his campaign around what they wanted to do, a key area of that healthcare policy. So let's take a couple minutes and unpack some of the key tenets of that healthcare policy, and then we can talk a little bit about likelihood and timing on the next slide as we look at possible scenarios for the Senate.
Yep. And that latter segue that you just described is going to be critical for really putting into focus or putting into perspective everything that we're about to talk about and whether they're going to get done. But what we wanted to do first is to talk about what the Biden healthcare plan and what the proposals under that healthcare plan, what they were trying to achieve, that being the Biden campaign, because now that it appears that former Vice President Biden is going to be indeed President Biden, what was he pushing or what was he proposing from a healthcare perspective? And again, Understanding this is very, very important for 2022, and we're going to get into that as we keep going through our presentation. So what did former Vice President Biden propose during the campaign, which really lends to what is President-elect Biden's healthcare plan? Well, on the campaign trail during the Democratic presidential primaries in the summer, as well as during the general election, former Vice President Biden continually said, I am not supporting Medicare for all. So now that President-elect Biden will likely be president, we know that Medicare for all is pretty much off the table. But we did hear former Vice President Biden on the campaign trail talk about a public option. And let's focus on public option for a moment. What really is a public option? We debated this back in 2009 and 2010 when the Affordable Care Act was being debated, that was finally, the Affordable Care Act being finally enacted, but the public option never made it in. And why is that? Well, there's some controversial aspects of a public option. Because of one, it's a health plan with a prescribed set of benefits. So it's more or less a cookie cutter of, in my opinion, a mix of the essential health benefits that we now have under the Affordable Care Act, and let's say a component of the Medicare benefits or benefits that Medicare must cover. But it's more or less a standardized plan. And in the employer market, we know that standardized plans generally don't work. It's nice to have the flexibility of picking and choosing and trying to figure out how you want to design your benefit plan. So a public option would differ from that, which is why a public option is somewhat significant relative to, let's say, the employer-sponsored system. The public option also would carry with it lower premiums. Well, how would a public option achieve lower premiums? Well, it achieves lower premiums by reimbursing medical providers at a lower rate than what private insurance currently reimburses those providers at. And more or less, it would be a percentage of Medicare, which is much lower than the percentage of Medicare that employers or the private insurance is currently reimbursing medical providers. You have to put it in perspective, the RAND Corporation, in my opinion, a nonpartisan, just highly technical type of group, put together some research data and found that employer plans were paying between 250% of Medicare and 350% of Medicare, depending on the state. Whereas you look at Medicare and you look at other aspects of Medicare, those are 40% lower to almost 60% lower from a reimbursement perspective relative to where employer plans are reimbursing. And if a public option is reimbursing those medical providers at a lower rate, 40, 60%, that is where you achieve the lower premiums. But that has some implications for the employer-sponsored system if there's lower reimbursement rates in the publicly subsidized or public-type healthcare programs, and could that exacerbate a cost shift that currently goes on between public programs and private employer-based insurance that medical providers typically engage in order to generate additional revenue to make up for any lost revenue from the lower reimbursement rates. So that's the reimbursement aspect of a public option. And then kind of thirdly, what would go on with a public option is who would administer it? Would it be a government-run program, or would it be something more like a Medicare Advantage that is still a government-defined program, prescribed benefits, prescribed reimbursement rates, but actually run and administered by private insurers? That's really what a public option is. Now, you see on my slide here, or our slide here with the first bullet, the question then comes in is, okay, you just described the public option to me, Chris. Who's eligible to enroll in the public option? Well, to an extent, during the campaign, we couldn't quite tell. The campaign website indicated that a public option would be made available to employees, where employees would be able to actually opt out of their employer plan and buy into the public option. However, when President Biden or Vice President Biden was asked during the debates and during the presidential primaries, he indicated that the public option would be limited to individuals who aren't offered employer-sponsored coverage. That's an important question that we have to answer or figure out who is indeed eligible. Right now, we don't quite know the answer, but it's an important question that we're going to need to find out going forward. So let me keep going through this particular slide because I don't want to spend too much time on the Biden healthcare plan because it might not come to fruition, which is what we'll talk about on the next slide. So let me get to the second bullet here, which is also a very, very important piece of information for the employer-sponsored community to know. And I explained it here by eliminating the firewall. Well, what's the firewall? The firewall is a current rule under the Affordable Care Act that says if an employee is offered an affordable minimum value plan, and there's definitions for affordable minimum value, I'm not going to go into them, but I can at some other date or even in the Q&A. But if the employee is offered an affordable minimum value plan, they are not eligible for a premium subsidy in the individual market. Well, the Biden healthcare plan would eliminate the firewall. It would actually allow anybody to be eligible for an Affordable Care Act premium subsidy to purchase an individual market plan, which would mean that an employee, if they're subsidy eligible, could opt out of their employer plan, go into the individual market, buy an individual market plan, and get a subsidy. And the Biden proposal also suggested that an employee could buy into the public option with a subsidy, which in many cases might make that plan $0 to the person, depending on their income, based on the lower premiums that a public option would carry. So we have the public option, employees can maybe buy into them, maybe not. We have eliminating the firewall, which would allow anybody to get the premium subsidy, which again, all have some serious implications for the employer-sponsored system and whether that unravels the employer-sponsored system by employees opting out. Now, the last piece here is the Biden proposal, which I think is a great idea, which is increasing the premium subsidies for those who are subsidy eligible, because we've heard the suggestions that you have this subsidized market of low to middle income individuals, but then you have middle to higher income individuals who aren't getting subsidized under the Affordable Care Act, and they can't afford health care coverage. Well, the one way to solve that is we'll increase the premium subsidy amount so more people are eligible. Well, that's what the Biden healthcare plan would do. But if that's the case and you piece that together with eliminating the firewall and the public option, you have more people eligible, you have more employees eligible for a premium subsidy at any income level, potentially, that could buy into a public option or otherwise, which again would carry implications for the employer-sponsored market. So that really, in a nutshell, is the Biden healthcare plan. And Tom, I'll turn it back to you to see if you have any thoughts, and then we can segue to the next slide.
Yeah, so super helpful. Just kind of running through those three tenets, Chris, and the potential impact on employer-sponsored benefits and what employers may decide to do. One of the dynamics has been to date that the individual market doesn't have great options. But if some of these policies could improve the options that are available and make them even more affordable, there are certainly some employers in certain industries and certainly sizes where they may make a different decision than they've made to date on, well, hey, maybe I shouldn't offer a traditional employer-sponsored plan. Maybe my employees could be better off here, but maybe not. However, as we noted at the beginning, one of the big things is the uncertainty around who will control the Senate, although it does appear to be leaning in one direction, but we may not know for a little bit longer. But that certainly puts some things either on the table or off the table. So I think the next key question, Chris, is as we look at the two potentials, what things, what are the likely scenarios? What kind of comes off the table if the Republicans run the Senate and is just really kind of a non-starter? What are some of the things that are likely because there's bipartisan desire for versus what does it look like if there's a Democrat majority? Because that seems like that leaves a lot more open to be achieved by the goals to be achieved that you just ran through.
Yeah, and it's a great point, and that's why I kind of wanted to kind of emphasize the various points of the Biden healthcare plan, because if we have a Senate Democratic majority, which you see in the left part of this slide as you're looking at it, much, if not, I'd say much, probably not all, but much, because politics are politics. Much of what I just talked about under the Biden healthcare plan could indeed make their way into law, which again would arguably have serious implications for the employer-sponsored system. But before I really touch back on public option, eliminating the firewall, increased subsidies, et cetera, let's quickly stop for a moment and just take a reality check to say COVID is still reigning and still creating lots of chaos. You know, we're already seeing another round of spikes. We're moving into the winter months. Public health officials are suggesting that with the winter months and folks being indoors and with the holidays coming up, we could even see more spikes or spikes increasing, or at least that spike that we're currently seeing continuing for a longer period of time than what we would see from a downward trajectory. So we do expect that in the lame duck session, which is what's called the session between the election and the end of the term, which ends at the end of this year, basically, we will likely see another stimulus package directed toward COVID and toward public health, infusing more money into the economy, helping those troubled industries, helping small businesses, helping individuals directly with stimulus checks. Well, how does that impact the employer-sponsored system and employee benefit plans? Well, we know that the prior stimulus packages actually said that plans must provide free coverage for COVID-related tests and services related to a person going to get that COVID test. Now, HHS followed up with some guidance clarifying that the COVID test has to be medically appropriate as determined by a physician. So there's been some question that's finally been answered by HHS that if you have an employer return to work program, that is not deemed to be medically appropriate by HHS because they feel that a physician has not deemed an employee return program as medically appropriate. So there's no free coverage there for that testing, which has caused some consternation. And we just had some recent guidance where, again, the federal department's confirmed certain things relating to testing as well as the vaccine that we might likely see in the next couple of months. So what might happen with President Biden and the Senate Democratic majority? Well, they would likely expand or extend the free coverage for testing, but they might likely, they being a President Biden and a Democratic majority in the Senate and a Democratic majority in the House, extend that free coverage to COVID treatment, because we did see the free coverage of COVID treatment in a House Democratic stimulus bill, which likely would make its way into something, or some piece of legislation, should we see a President Biden Senate majority, Democratic majority, which is important for us all to know because we're now living this COVID nightmare. And from an employee benefit perspective, you guys are dealing with the rules relating to free coverage for testing, free coverage for vaccines when that comes online, and how that's all going to shake out. I expect extensions of those rules and potential expansions. Now back to what happens with public option, firewall, et cetera. Well, if you have a Democratic majority, they likely could get that done through, and I'm not going to go into detail on this, through a procedural rule called reconciliation that some of you may be aware of because the Affordable Care Act back in 2010 was passed through reconciliation. The repeal and replace exercise that happened in 2017 was done through the reconciliation process. Tax reform at the end of 2017 was done through reconciliation. So a lot of people now understand the reconciliation process, which only requires 51 votes in the Senate, and that's likely a tool that could be used to get the Biden healthcare plan into the law. But what else could we see with a Biden presidency and a Democratic majority? Well, President Biden and now Vice President-elect Harris had talked about a Medicare buy-in program for individuals ages 60 to 64. The question that we have there is, will that be available to employees? And if they're offered an employer plan, will the quote unquote firewall apply to them or not? Maybe not if the Biden administration wants to get rid of the firewall for the ACA subsidies. So that's going to be a big deal and have some implications on employer plans. Obviously, I talked about increased premium subsidies. Drug pricing legislation would likely happen under a President Biden and a Democratic majority. I also think that might happen in the next thing that we're going to talk about. And surprise billing has been a big issue over the past 2 years, and there just hasn't been bipartisan support. They can't come to agreement. If we had unified government, House Democrat, Senate Democrat, President Biden, I think they get surprise billing done in the way that the Democrats want surprise billing done. Now let's flip. I'm sorry I'm talking so much, but let's flip over now to a President Biden and the Senate Republican majority. And why is this most important? Because as I told you before, Senate Republicans outperformed in this past election. And while we don't quite have certainty yet on whether Republicans indeed maintain the majority, because as many of you might be reading in the news, we have to wait for what's called election runoffs in the state of Georgia, because state of Georgia, unlike a lot of other states, say if the candidates don't get 50%, then they will go to a separate election at a future date, in this case, January 4th, to determine who wins that seat. Well, because the margin in the Senate is so close, it's generally going to come down to these two seats in Georgia, these two runoff races to determine who will get the majority. Now, most political observers, like myself, feel that the Republicans will win one of those two runoff races. And if the Republicans do, then they will maintain the majority. Now, you can never say never in politics, right? We just talked about surprises that we just experienced in this most recent election. We certainly saw big surprises in 2016. Do we see a big surprise come January 4th? We might. But again, the conventional wisdom is Republicans hold on to the majority. And what would that mean? Well, let me stop to say, and because you can never say never, we needed to focus on Biden and the Democratic majority. So let's go to, again, Biden Republican majority. Well, the Senate Republicans aren't going to go along with a public option, aren't going to get rid of the firewall, aren't going to increase the premium subsidies. They're just not going to do it. So what can get done during a Republican majority 2 years as well as President Biden? Well, again, back to COVID. We're going to have another stimulus package at some point. I would expect an extension of the free coverage for testing. Do I expect an expansion for free coverage of treatment? I don't. Maybe it happens because, again, the margins are so tight, but I still don't see it happen, but it could happen. The vaccine's already in law. The free coverage for the vaccine's already in law. You already saw guidance, so I don't think that's going to change. I think instead that's going to get expanded, just speaking of the vaccine. But what other stuff can happen if public option and Medicare buy-ins aren't going to happen? Well, we could see an ACA stabilization bill. That would be more or less like a federal reinsurance program. That would really only impact the individual market, so it won't really impact employers, of course. Drug pricing legislation, however, I am a big believer. I have a big bet on drug pricing legislation happening in the next 2 years under a Biden and a Republican majority. And why do I think that? Because President Biden himself is known to be a deal cutter. He cuts deals. He's a pragmatist. Yes, every politician is political, but Biden has shown some areas where he's been pragmatic, and he's wanted to get stuff done on a bipartisan basis. Senator McConnell, who will be the majority leader in the Senate, he too has cut deals. He doesn't cut deals to the same extent, let's say, a Biden does, or as many times and many often as a President Biden might. But McConnell, when he feels it's important for his own members to cut a deal, he'll cut a deal. And what of any of the pieces of legislation or policy changes that could happen throughout these next 2 years that I think a deal could be cut, it would be drug pricing legislation. We've already seen a Republican and Democrat proposal in the Senate. We've already seen what the House Democrats have laid out on the table. We've seen what the Trump administration has wanted to do. And the Biden administration will pick off many of those proposals that even the Trump administration has proposed that I think will come into a package that the House, the Senate Republicans, as well as Biden could agree on. Surprise billing. Again, there's bipartisan agreement for the solution to get it done, but the solution eludes that bipartisan support. I think it gets done even with a Republican majority in a Biden presidency. Increasing transparency, which is something, hopefully we'll spend a little bit of time on. I know I'm talking so much, but increasing transparency. Why is increasing transparency on this list? Well, we just saw right before the election, the Trump administration finalized regulations that will require fully insured and self-insured group health plans to disclose their negotiated in-network rates, as well as provide cost-sharing information to participants. Now, that's in a regulation. Could we see that regulation codified in legislation? Could the Biden administration cut a deal, again, President Biden cutting a deal with Republicans, to codify much of the Trump administration's transparency regs, as well as include, let's say, some Democratic transparency priorities that maybe the insurance community would rather see relative to what we've seen in the Trump administration's proposals? Very well could see that. So I could very well see increasing transparency legislation finding its way across the finish line of the president's desk over the next 2 years. And the employer mandate reporting relief, that's always been on the docket for the past 10 years now, right? Could it happen in a Biden Republican majority? Maybe, because it's the thing that's been hanging out there that actually has bipartisan support that's Affordable Care Act related. So we could indeed see that. So let me finally stop talking, Tom, turn it back to you and see if you have any thoughts.
Yeah, that's great. Super in depth, and so just obviously there's a key dynamic here, which is the Senate, and we won't really know until early next year. And I think a key point you called out is that it impacts timing. Is there is still a global pandemic, and as well, we don't know Biden's 100-day plan and what will likely be priorities. COVID is almost certainly guaranteed to be in that. We've already seen some activity in that regard, and it's unlikely that some of these policy dynamics that we've seen related to ACA subsidies would be in that. They would probably come later with the need to focus on the pandemic. And so that's an interesting dynamic to factor in as we think about timing of potential impacts. And then certainly the differences here, if you see a Republican majority in the Senate versus a Democratic majority in the Senate, and the need to compromise on, and so that kind of takes us to our next, which is, knowing that there is some uncertainty, are there some things that you see as likely, kind of regardless of, either of these scenarios, to move forward? And I know you've touched on a few of them here, but maybe just summarize them and kind of restate them in just kind of quick bullets of, knowing there's a Biden administration, regardless of it's Republican or Democratic controlled Senate, and here are some things we think could happen in the impact to employer-sponsored healthcare.
Yeah, and again, assuming there's a Republican majority for these next 2 years, again, the big ticket item that was part of the Biden healthcare plan won't happen. I think there's other stuff, and I've talked about them. So if the Biden administration can't get its big ticket items done through legislation, what will a Biden administration try to do through administrative means, through regulations? Well, much of what I discussed under the Biden healthcare plan is intended to, quote unquote, improve the Affordable Care Act. And in most cases, that improvement is limited to the individual market. Now, depending on the breadth and the extent of those improvements, that's going to have an impact on the employer-sponsored market, as I discussed. But considering that those changes that are going to impact the employer market can only be done through acts of Congress, through legislation, and because we have a Republican majority, or it looks like it, those big-ticket items that's going to affect employers probably won't happen. Employers can generally rest easy, at least for the next 2 years, that these improvements to the ACA that I think the Biden administration will try to achieve through regulation won't impact the employer-sponsored market, because regulations don't change the law. you have to act within the current statute through regulations. To an extent, you can push the envelope with regulations. You can try to change the statute through regulation. But if a Biden administration tries to change the statute through regulation, and the fact that over these past 4 years, Majority Leader McConnell in the Senate successfully got about 220 conservative leading judges on the bench, on the courts, that the new normal of litigation against regulations will continue to be the new normal. I would expect that if and when a Biden administration issues regulations to improve the ACA, and if those regulations really push the envelope and try to change the statute, then I could see litigation ensuing, and it's going to be in the hands of, a different judicial system that we now have out there. I'm not saying that's good or bad. I'm just saying that's the reality. I don't really want to get into what the Biden administration could do to improve the ACA through regulations, because that's really almost individual market related, and I don't think that's going to have a big impact on employers. So within the interest of time, I'll just keep moving. I told you, and you, it's abundantly clear, because I'm sure you all know, that right before the election, the Trump administration issued final regulations for increasing transparency for fully insured and self-insured group health plans, negotiated network rates, showing out-of-network payments, as well as providing cost-sharing information. And that's a regulation. That's a final regulation. So that is the law. Now, a future administration can change a regulation. They can, quote-unquote, change the law, provided they go through the right process of issuing proposed regulations, accepting public comments, finalizing those regulations. So the question is, will the Biden administration modify the regulations that were just finalized by the Trump administration? The insurance community, the insurance carrier industry is not enthused with the transparency regs. So could we see a lobbying blitz pushing the Biden administration to modify the Trump administration regs? I think the answer is yes, wholeheartedly yes. But will the Biden administration listen or accede to those requests to modifying the regs? Remains to be seen. But if the regs are changed, it's going to take a little bit of time. So watch out for that. Contemporaneous with this regulatory exercise, I do think that there's some activity in Congress on the legislative level, as I've discussed before. The last two bullets, we've heard the Biden administration and ACA supporters say, hey, if Biden is elected, we're going to get rid of the short-term health plan rules. I do think that would happen. They've suggested getting rid of the association health plan regulations. I don't know if that's going to happen, but it could happen. I don't think that those two issues really impact employee benefits and employer-sponsored plans to a significant degree, but know that could happen. ICRAs, the individual coverage HRAs, this is something that I think the HR community and the employer-sponsored community does care about. Out of all of the three regulations that were issued by the Trump administration, the ICRA rules were not challenged in court. That's because I think the ACA supporters think that the ICRA rules, the individual coverage HRA rules, are actually good for the ACA. So I actually think that the Biden administration could build on the ICRA rules, or at least let them go, be status quo, and see where the market goes and what take-up there is on ICRAs. Because it's a Biden administration, Democratic-leaning policymakers are not big on health savings accounts, so I could see little changes to the HSA rules relative to where there would be bigger changes if we did see a Trump reelect. Go ahead and go to the next slide, Tom, or I'll turn it back to you for any commentary.
Yeah, no, that's great. I think, as you look at the transparency regulations, we've got a question for the group. I think that's the one that has some, pretty sizable potential impact, regardless of what you're doing from an employer-sponsored health plan perspective. And so, that's an interesting one to be aware of, keep an eye on, and understand. The timing will be key, certainly, but that's a key one. And so, as we want to make sure we have time for Q&A, and this last topic is certainly one we could spend more than 2 minutes on. We could probably spend a couple of days on. but is just with the Supreme Court and the activity starting today, what should this group, in 2 minutes or less, what should this group be kind of watching for? And when do you believe a ruling could be made, or we could hear something from the Supreme Court?
Yeah, even though I'm long-winded, I think I could do it in maybe 45 seconds. So I'm here to say that I think the Affordable Care Act is here to stay. I do not think that the Supreme Court will find the entire law unconstitutional. It's likely that the individual mandate penalty tax is unconstitutional, but I do believe that there will be at least 5 justices on the court, irrespective of the new justice that just filled the vacancy. I think there'll be 5 justices on the court that will uphold the entire Affordable Care Act. To timing of a ruling, typically the Supreme Court does not rule on big cases until June of the year following the year it does oral arguments. In this case, it's 2020. Sometimes there's oral arguments at the beginning of 2021. So I would expect a ruling in June of 2021. Maybe we see it in spring of 2021, but it's certainly not going to come before that. So spring or June of 2021 ruling, Affordable Care Act is here to stay.
Great. All right. So let's move into some questions. And what we can start with is we had a couple questions just for the group, just to get some perspective. And so we'll go ahead and pose the first question. And so Chris talked about the firewall, which is today limits those who get who are offered an employer-sponsored benefit that meets certain requirements from getting subsidies through the individual market. If that was removed and the subsidies or public options were available, how would it impact your benefit strategy? And so no impact. Would you reduce some of your coverage options? Would you actually increase healthcare coverage options, add some supplemental healthcare benefits to go with that, maybe reducing coverage, or consider offering an individual coverage HRA as part of a strategy to help those who wanted to go and get one of the available options? Again, if the firewall was removed. And now, Rhonda, are you still on? Are we able to see the results of the poll in just a moment, or should we do the second polling question before we look at results?
Absolutely. I will end the poll here, folks. Thanks for submitting your responses, and here you go.
Okay, great. And everybody can see the results? Just making sure. I know I can see them. So 35%, no impact. About a quarter would consider reducing options. It's super interesting. And then about a third consider offering individual coverage HRA. Pretty light on the adding more coverage. So that's interesting. Very helpful for us to see that.
Yeah, and Tom, let me stop you there before you go to the next poll question. And in the interest of time, I'm going to try to sum it up in a minute and a half. I mentioned 2022 and 2022 being such a big deal. The Senate could flip in 2022. So if Republicans hold on the majority based on these Georgia runoffs, like I've mentioned, they're only going to have a 51 or 52 seat majority. There are almost double the Republican senators up for re-election in 22 relative to the Democratic senators that are up. So the blue wave that didn't happen this time around may not happen in 2022, but at least it could be enough of a blue shift where Democrats regain the majority or retake the majority in the Senate. And everything that we talked about on that slide previously, and the public option, and the firewall going, and the increased premium subsidies and being available to anybody, could indeed happen post-2022. Everyone's so focused on this most recent election, but actually maybe it's the DC geek in me is saying to myself, no, we've got to now look at 2022 because what we thought could happen this time around and didn't could very well happen next time around. So this question is super relevant for the next 2 years for us to all contemplate and determine what the world's going to look like post-2022 because the Senate could very well flip.
Yeah, it's a great additional consideration as we think about it. And so it's super interesting, both for us to see it and from our perspective, but hopefully for each of you to see what your colleagues are thinking of different approaches they might take. So we'll do the next polling question and then open it up. There's a few questions that have been posed. And so next question, Chris talked about the transparency regulations and provided a little bit of what those are and what the impact is in the employer-sponsored realm. So how would you rate your awareness and readiness for the impact of those? Or is it news to you today? Were you not aware? Were you aware of it, but you haven't really started to get too deep into evaluations? Have you already been actively evaluating solutions, maybe just because you feel it's valuable to provide some transparency? And then anyone who's currently implementing or those that may have already implemented something, regardless of regulations, because you saw it as a valuable solution to provide to your employees as they make decisions about how best to use their healthcare. So we'll take a minute or two to collect answers, and then we'll shift into looking at the results.
All right, I just give it another 10 seconds, folks. Thanks so much for responding. All right, and here you go, Tom. Here's your results.
Great. Okay. Yeah, that's helpful to see. And so a lot of folks are early stage, either not aware, they are relatively new as they were just issued last week, as Chris said, and then some aware but not yet started. Certainly there's some time to do something directly and relate to the regulations. And then interesting to see, 6% already have something available and being offered to your employees that you may have had for a while. Certainly the solutions have been out there that provide transparency. So that's great to see. Okay, so shifting into the general.
Let me, if you'll indulge me, let me just add my 2 cents on the transparency really quick. For those people who aren't aware, like the transparency regs, in my opinion, are a big deal. Now, the positive, at least for those who are not aware, is there are staggered effective dates for these particular regulations. In particular, the disclosure of in-network negotiated rates are not effective, or that rule, that requirement is not effective until January 1 of 2022. The cost-sharing information that plans, both fully insured and self-insured plans, must share with their participants is not effective until January 1, 2023. For up to 500 shoppable medical items and services, and the regulations list out those 500. And the next set for this cost-sharing liability information that you must provide on all information, on all medical items and services, that's not effective until January 1, 2024. So you have some time to figure it out. We also have to wait to see how a Biden administration treats the regulations that were just issued and what happens at a legislative level. But I think it's very important for folks to wrap their head around the transparency rules sooner rather than later, because 2022 can be here, will be here sooner than folks think.
Yeah, no, that's great. That's great, helpful context, especially on the timing and the ramp time, since many of the evaluation and solutions tied to benefits does take a bit of lead time to evaluate and then get them implemented, and to time it and a good time to roll it out to make sense for your employees as well, in partnership with other things you may be doing in your benefit strategy. So now into the Q&A. These are the questions that were received during the presentation. So first one relates to the availability of someone who's being offered an employer-sponsored plan to get access to a subsidy or public. Is the ability to opt out of the employer-sponsored plan and into the public option, or the minimum plan, not subject to SME benchmarks, including a means test?
And so the question's like, is that going to be allowed? I'm sorry, restate the question.
I think that's how I'd interpret the question, and it may be a question of if there is a firewall removed, if the firewall is removed, would some of the dynamics that limit you from being eligible be completely removed? And the SME benchmarks and means test were the 2 examples that were.
Yes. Okay. So got it. So yes. So the Biden healthcare plan, which I guess I alluded to, but not with a fine point, would blow off the 400% of federal poverty level eligibility or income requirement, and the firewall would be gone. So to summarize it, any employee at any income level would be able to opt out at any time and purchase a public option or another ACA individual market plan that's available through an ACA exchange. So any person at any income level can opt out, any employee at any income, et cetera, even if they're offered an affordable minimum value plan.
Okay, the next question, which I'm pretty sure I know how you'll answer, is the Supreme Court likely to preemptively rule on Trump's attempts to kill the ACA before President-elect Biden introduces his proposed reforms, which I think you noted both the timing you felt it would be next summer, and that regardless of the current makeup, you felt at least 5 justices would rule in such a way that the ACA is here to stay, although a piece of it may be impacted as a result of that. But I'll let you add any additional color to that you shared earlier.
Yeah, so no, I do not think that the Supreme Court will preempt the current timeline on when a final ruling will be laid down. So that's not going to happen. So we're going to have oral arguments today. The justices are going to consider how they want to vote on the ruling.
I think we may have just lost Chris. Rhonda, are you still there?
Yeah, still here. He might have lost his internet. He'll be
Yeah,
popping back in hopefully shortly.
Yeah, I'm making sure I'm still here.
Yeah.
So I can, one of the other questions that was posed, I can address, it was, what's the difference between a self-insured and fully insured plan? And so self-insured plans, predominantly larger employers are implementing self-insured health plans. And that is where they're effectively bearing the risk of the plan. And they are working with traditional health plans for administrative services only, so facilitating the processing of claims, billing, but ultimately the employer bears the risk and designs the plan, usually in working closely with their broker, whereas fully insured, the health plan is bearing the risk associated with the insurance product of the health plan. And we typically see those more in the smaller groups. Once you get to the 500 employees, you start to see a shift into self-insured. There are some other dynamics that may come into play there.
All right, I think I'm back, by the way. I'm very sorry for that technical. That's the world we live in.
Yeah, we can.
Yeah,
we can hear you. You're a little choppy. I just answered one of the other questions. I think we've got. Let's see. We've got 2 minutes, so there's one more question that I think we can tackle, which you touched on a little bit with drug pricing. The question that was posed was, how likely is Biden to introducing a Canadian type drug plan? And the likelihood of that in the next 2 years is probably the key kind of summarization of the question. So maybe expand on what you shared, on what you felt was possible with drug pricing and any kind of policy regulation that you think could come out in the next couple of years.
From a drug policy perspective. So in that case, I could see some impact on PBMs and the rebates that are more or less hidden when it comes to plans working with a PBM to provide the prescription drugs offerings to benefits to those plan participants. So I could see increased disclosure of the rebates and or a mandate that those rebates be passed on to the plan and the plan participants, as opposed to, again, continuing to be hidden and or allocated to other aspects of the PBM's bottom line or the insurance carrier that the PBM may be a part of, because many insurance carriers have been buying up PBMs and housing them underneath the umbrella of the insurance carrier and the services that they provide. So I could certainly see that. Medicare Part D, particular caps on how much a Medicare beneficiary is going to be required to pay under the Medicare Part D program. That's, may not impact employer-sponsored plans directly, but it certainly has an impact. Lastly, just President Trump, as well as even President Biden, had suggested the government negotiating drug prices for Medicare. That probably won't get into drug pricing legislation, but could we see some sort of drug reimportation or drug importation type of policy that's available both to the public programs as well as to the employer-sponsored community? Yes, I could see that, and you could see a result where that reimportation provision lowers the cost of prescription drugs for private employer plans, in addition to obviously the public programs.
Okay, great. Yeah, and I think we're up against the top of the hour. I know there's some other sessions, so I appreciate that last question answer. And just before handing things back over to Rhonda, I just wanted to thank everybody for their time, certainly the engagement on the polling and the good questions there at the end. This is certainly an interesting top of mind topic for many, and as we noted, there's a little bit of uncertainty, and so there'll be a number of things to watch in the coming months. So again, thanks everybody for their time, and I'll hand things back over to Rhonda.
Yeah, that's great. Thanks so much to Tom Dugan and to you, Chris. Thank you so much. Great information. I know that folks really appreciate it. If you'd like to view the webcast again, it will be archived. I'll have that archived on hr.com later today, so check back, but we'll also send you an email with a link to that as well as your credit information. So please take a moment to fill out. There is an exit survey. It's going to pop open on your computer in a new browser as I close out the session. So please take a moment to fill that out, as the feedback's important to us, and it's also important to Benefit Focus. So stay well, everyone. Take care.
Thanks, everybody.
Thanks. Sorry for the technical difficulties.
All good.